Well, I found out that I was pregnant in April. I wasn't sure what I was going to do, and then I went to the doctor and I did a routine blood test. It was hard simply because I knew that I was going to have to make a really hard decision when it came to my being pregnant.
Young adults who are survivors of cancer often have issues that people of other ages don't encounter.
My OBGYN was the one who was the catalyst for me finding out that I had cancer. I was actually diagnosed when I was 14 weeks pregnant. I had a lump that had been ignored for about 3.5 years, undiagnosed. The first time I went in to see my GP, I knew that there was something there. I said, "Are you concerned about this?" And she said, "Oh, no," and just totally blew it off because I didn't have any risk factors. I was 33. The next year when I went in for my annual, I saw a different doctor who did say, "Hey, we need to look into this." But I did a mammogram, which was followed by an ultrasound. Again, nothing. I got a letter in the mail saying, "Hey, it's the structure of your breast." I wasn't really satisfied with that answer, but I didn't really know how to advocate for myself. And then the following year, I went and saw a OBGYN, and that was when, through something that was as simple as a fine needle biopsy in an office setting, could have told me, 3.5 years earlier that I had cancer. The first thing that they did was haul me in for a mastectomy on my left side. I can't even describe how horrific that was. It was terrifying, but fortunately there were some resources that we could look at to understand that at this stage in our history, cancer history, they're not choosing the mother over the child. There's enough data now that we can see that babies can survive chemo. She was delivered full term, and we were just so relieved. She was healthy and big and strong, and my goodness, she is a fighter, that girl.
His head surgery was on a Saturday, the tumor resection, and then he was supposed to start radiation like the following day or something like that. It was really quick, and basically they said, I think you guys should bank some sperm because we don't really know what the treatments are going to do. They can make you sterile, and so he has this fresh scar. And it's like fresh, and we go in, and it's such an awkward experience. I just have to throw that out there. But then a couple of months ago, we found out that, in fact, it was, essential that we had done that, and now we have some frozen ones just waiting on ice.
For someday.
Once we found out that I had a tumor that was within millimeters of my uterus, first of all, they didn't even know what kind of cancer it was. They were suspecting maybe uterine cancer, cervical cancer. The real hard part with my husband was I was told that I might not be able to have children. That was probably the hardest part, going through that together, thinking that he'd married someone and wanted to have children and we might not be able to do that. But then once they had the biopsy, they knew that it was just gastrointestinal stromal tumor.
Okay, Katie, we're going to start the pictures. Taking a breath.
So immediately within 1 week, I started fertility treatments, and we have frozen embryos just in case.
Give me a hand. Thank you. You're welcome. I think a huge area that is overlooked, probably in all types of patients, regardless of their age, is issues about sexuality.
Trying to get back in the dating world is hard enough, but when you're having physical issues, and they don't even have to be the actual body image issues, but side effects from treatment, any of the diarrhea, constipation, any of those things that you enter into the dating world and you're concerned about, creating intimacy again when you've lost your breasts or you have a colostomy or urostomy bag is really difficult.
My brain surgeon's assistant, he gave me a really good piece of advice that really stuck with me through the whole thing. He told me that you'll probably go through a phase in your recovery where you're probably going to feel like not as much of a man just because you're married. He said that that would probably be the hardest thing for you to deal with. And it was for a long time for me. Just not feeling you can protect your wife like you want to and stuff. He's like, you're sick. You don't have to be that. You know, it just really helped me a lot. Because it made me realize that though my wife, my mom, and my friends and my family needed me, you know, that I didn't have to try to live up to anything that specific.
They're not as experienced at self-advocating, especially to healthcare providers. So they may think if the doctor, nurse, social worker doesn't bring up sexual functioning, I guess I'm not supposed to. Or if they don't bring up the impact on my career, maybe everyone's supposed to just suffer through that.
Our life was put on hold. Now she's on disability, which is great that we get that. And I'm rebuilding a career at less than 2/3 of what I used to make.
Financially, this is a population that has a lot of barriers against them. So sometimes they will get to a point of either bankruptcy or really insolvency. I mean, like a place where they can't build their life at a time where that was the expectation. That's what their friends are doing.
They might worry about job interviews. You know, how do I explain this huge gap of unemployment on my resume? If a young adult is storming up the career ladder, worrying about taking an FMLA, a family medical leave of absence, to go on treatment or to take care of their family.
Sometimes for young adults, they're even more concerned about young children than they even are about their own health.
I got a responsibility, and that's my daughter, and that's the #1 priority. I'm getting support from church members, close friends, because I told the whole church, and everybody stepped up to the plate. If they wasn't around, I don't know what I would really do.
And I worked very closely with a young adult patient who had small children and got to know her kids. They'd come in, and unfortunately she didn't do well and she died here in the hospital, and I was with her at the time of her death and spent time with her kids. And that goes with the emotional side of things too, is partnering with people to say, you know, what do you need to get through this? And in this woman's situation, it was, you know, help my kids understand. So it was hard, and at the same time, it was a gift to be able to walk that part of the journey with her and her family.